Ever wondered why sometimes your period seems lighter or different than usual? Could it be implantation bleeding or just a regular menstrual cycle? Today we're exploring this intriguing topic that has left many scratching their heads in confusion. Let's set the stage a bit. We all know about periods, that monthly visitor that reminds us of our reproductive capabilities, but then there's this thing called implantation bleeding, a lesser-known phenomenon that can occur early in pregnancy. It's easy to confuse the two, especially when they can look and feel so similar. Are you curious yet? Intrigued about how to tell the difference between your regular period and implantation bleeding? Well, you're in the right place. We're about to embark on a journey of discovery, unraveling the mysteries behind these two biological occurrences. Stay tuned as we delve deeper into the key differences between implantation bleeding and regular periods. First off, let's understand what a period is. A period, also known as menstruation, is a natural and healthy part of the female reproductive cycle. It's the body's way of preparing for a possible pregnancy each month. When pregnancy doesn't occur, the uterus sheds its lining, resulting in a period. This process usually happens every 28 to 30 days, although the cycle can range from 21 to 35 days in adults and from 21 to 45 days in young teens. The period itself typically lasts between 3 and 7 days. It's normal for the duration and timing to fluctuate, especially in the first few years after menstruation begins. Now, let's talk about some of the associated symptoms. One of the most common is cramping in the lower abdomen, which is caused by the uterus contracting to shed its lining. These cramps can vary from mild to severe, and they usually start a day or two before the period and continue for a few days into it. Another common symptom is mood swings. These can be caused by fluctuations in hormone levels during the menstrual cycle, which can affect mood and energy levels. Some people may experience feelings of irritability, sadness, or anxiety in the days leading up to their period. Lastly, let's touch on heavy bleeding or menorrhagia. This is when a woman loses an excessive amount of blood during her period, or when it lasts longer than 7 days. It can be caused by a number of factors, including hormonal imbalances, uterine fibroids, or polyps. If you're experiencing heavy bleeding, it's important to consult a healthcare provider, as it can lead to anemia if left untreated. So in a nutshell, a period is a normal part of the menstrual cycle, characterized by the shedding of the uterine lining, typically recurring every month, and often accompanied by symptoms like cramps, mood swings, and potentially heavy bleeding. Now that we've understood what a period is, let's move on to implantation bleeding. Implantation bleeding, a term that might sound unfamiliar to many, plays a crucial role in the early stages of pregnancy. But what exactly is it? Let's dive into this fascinating event that takes place right at the beginning of a pregnancy journey. Implantation bleeding is a light spotting or bleeding that happens when a fertilized egg attaches itself to the inner lining of the uterus. This usually occurs about 6 to 12 days after conception, which is roughly around the same time you'd expect your regular period. But remember, it's not your period. Here's why it happens. Once the egg is fertilized, it travels down the fallopian tube and makes its home in the uterus. As it burrows into the uterine wall to establish a nourishing connection, it may cause a little bit of bleeding. This is implantation bleeding, a natural part of the pregnancy process. In terms of duration, it's usually quite brief. Implantation bleeding typically lasts anywhere from a few hours to a few days. Rarely does it last more than 3 days. It's also important to note that not every woman experiences implantation bleeding, so if you don't notice it, there's no cause for concern. Now, what does implantation bleeding look like? It's typically lighter in color than your normal menstrual blood. It can range from light pink to rust brown, and unlike a regular period, it's usually very light and doesn't come with the same symptoms like cramping or mood swings. But remember, while it's a potential sign of pregnancy, implantation bleeding is not a guaranteed indication. There are many other factors at play, and only a proper pregnancy test can confirm it. To sum up, implantation bleeding is a unique phenomenon occurring in the early stages of pregnancy, caused by the attachment of the fertilized egg to the uterus. It's brief, light, and differs in color and symptoms from regular menstrual bleeding. So, we've covered the basics of both period and implantation bleeding, but how can we tell them apart? Although they may seem similar at first glance, implantation bleeding and periods have some key differences that help us distinguish between them. Let's start with timing. Implantation bleeding typically occurs 6 to 12 days after conception. It's essentially the body's way of making room for a new life. On the other hand, a period usually arrives every 28 days or so, although this can vary from woman to woman. It's part of the menstrual cycle, a regular biological process that prepares the body for potential pregnancy. Next up is colour. Implantation bleeding tends to be a lighter shade than a regular period. You might notice a pinkish or brownish hue, which is a result of the small amount of blood mixing with your regular vaginal discharge. In contrast, menstrual blood is usually bright to dark red and can contain clots. In terms of flow, implantation bleeding is typically a lot lighter than a period. It's often so light that it might only be noticeable on toilet paper after wiping. A period, however, usually starts light, becomes heavy, and then lightens up again over the course of several days. Duration is another important factor. Implantation bleeding is quite brief, often lasting only a few hours to a couple of days. Periods, on the other hand, typically last between 3 to 7 days. Lastly, let's talk about associated symptoms. Implantation bleeding is often accompanied by mild cramping, a slight drop in body temperature, and tender breasts. Periods, however, are often associated with more intense cramps, bloating, mood swings, and a general feeling of discomfort. Understanding these differences can help you identify whether you're experiencing a regular period or implantation bleeding. Remember, when in doubt, always consult a healthcare professional.